Good evening. Our sign language interpreter tonight is Wilson Ochuka, and Friday night starts now. And we begin our broadcast with an update on the outbreak of Mpox disease. And the Ministry of Health has confirmed a second case of Mpox disease from a truck driver at the Malaba border in Busia County. Health Cabinet Secretary Deborah Barasa says the patient has been isolated at a facility in Busia County, even as they activate surveillance for suspected cases across all counties. As Marianne Nyambura reports, the Africa Center for Disease Control wants member states to approve the utilization of Mpox vaccines after the body put in place supply chain logistics.
Barely 3 weeks after the first case of Mpox was reported in the country, and the Ministry of Health has reported the detection of yet another case in Malaba, Busia County. In a statement sent to newsrooms, Health Cabinet Secretary Deborah Barasa says a truck driver who was presented to the Malaba one-stop border health screening desk had symptoms of the disease and a history of travel to the Democratic Republic of Congo, the epicenter of the outbreak. The ministry says the patient has been put in isolation at a health facility in Busia, even as they activate surveillance of suspected cases of Mpox across the region and all counties to contain the spread of the disease. 42 samples have been submitted for testing. 40 samples turned out negative. 426,438 travelers across the country have also been screened at the various points of entry.
I want to confirm to the country that in Kenya, we only have 2 cases that had been confirmed. One is healed and has already gone to another country. Now we have one that we are taking care of. We are doing what we call contact tracing. Sababu mtu akipatikana, tutataka kujua ni nani mwingine yoyote wamekuwa na yeye. Ndio pia yeye aende akatibiwe.
The ministry has urged all Kenyans to take necessary measures to safeguard their health and safety, including washing hands regularly with soap and running water, and practicing good hygiene. On the African front, the Africa Center for Disease Control Director General Dr. Jean Kaseya, in a letter to all ministers of health across the African Union member states, advised against the reliance on laboratory test results for diagnosing Mpox, calling for a holistic approach in detection, including clinical assessments. Kaseya also urging other member states to embrace and approve the introduction of Mpox vaccines, like countries such as Nigeria, South Africa, and DRC. So far, the Africa CDC has put in place measures for member states to secure the vaccines. The Africa CDC will also support countries at a risk of Mpox have an updated response and preparedness plan. Marianne Nyambura, Citizen TV.
And now joining us live is Health PS Mary Modoni. She is talking to us virtually tonight. Good evening, PS Mary Modoni.
Good evening, Lillian, and can you hear me?
Yes, we can hear you. Good evening. How are you doing today?
Very well, thank you.
All right, let's begin with the latest. PS, are you aware who has previously come into the contact with the Malaba case? Where is the confirmed case as of now? And talking about contact tracing, do we know how many persons this particular case came into contact with as of now?
Lillian, we are doing what we call contact tracing because we need to confirm how many people that the affected got in contact with. So the whole of this weekend, we will be doing a lot of contact tracing and ensuring that we are getting to know where they are.
From what we know, PS, the particular case that we're speaking about is in an isolation center, in a health facility. You have not disclosed what health facility in particular this is and where. Are you able to give us that information?
The case was confirmed in Kocholia, Teso North Sub-County, Busia County, was identified by a WHO. And Lillian, we will be continuing to give as much information as possible as it comes through. Remember, this is very sensitive information, and we do not also want stigmatization of the people who are being, who have Mpox.
Right. PS, let's talk about the accuracy of the Mpox testing. According to the Africa CDC, the accuracy of Mpox testing depends significantly on when the sample is collected. At least that's what we understand as of now. So if the sample is taken too early or too late in the course of infection, the viral load might be too low to be detected. So in terms of the samples that you've collected, the Ministry of Health tells us that 40 samples have been tested, have turned out negative. How do we know, how sure are we about the accuracy of these results based on the timing of when these samples were taken and when the tests were done?
Lillian, we have a cumulative number of laboratories in the country, and I want to attest that we are able to test Mpox in a number of laboratories. What we do and why it takes a little longer is because we have to confirm from different labs. If it's Cambry, we have to share with Africa CDC and many other labs. Therefore, the cumulative number of samples that have been received have also been confirmed in different other labs to ensure accuracy and to ensure that we are not giving the wrong information to the public.
Right.
So far, we have 52 samples that have been received in the laboratories, and of these, 2 have tested positive, and 45 others have tested negative, and 5 are currently being tested.
Now, in terms of the high level of population movement within the region between Kenya and the East African countries, especially along the northern and central transport corridors, there are concerns that this poses a significant risk of cross-border transmission, PS, with Kenya now reporting a second case of Mpox. Are there ongoing talks around possible travel restrictions now that the risk has actually, it seems to have risen now that we have a second confirmed case in less than a fortnight?
Remember, Lillian, Kenya is not a high prevalence area for Mpox, but because of trade and traveling, we are on high risk. Therefore, we are doing a lot of sensitization, and especially to the truck drivers. Currently, we are also doing a lot of screening. We have enhanced our screening at the border point at every port of entry. And we equally are ensuring that we sensitize the same to ongoing at all stopovers, and equally the surveillance is very, very high. Therefore, this is about ensuring that the public know what they need to do to ensure that they prevent themselves from Mpox.
We are thankful for your time, PS Mary Muthoni, Public Health. We thank you for your time. That's all the time we had tonight. It is a developing story. We will stay with the Mpox story. And remember, the Africa Center for Disease Control wants member states to approve the utilization of Mpox vaccines after the body put in place supply chain logistics. As of now, the vaccine is not available.